Welcome to my first video on the upper limb. We're talking about the bones of the upper limb. The bones of the upper limb. So first of all, you have to know about the bones. From the bones, you know about the muscles. From the muscles, you know about the actions, the nerves, the blood supply. So arrange it so that it will be very, very easy for you to understand. Very, very simple. And for the bones, we'll be picking about the clavicle. So let us speak about some peculiarity stuff that you can know about the clavicle that is very, very important for your exams. So as you are looking at it on your screen or you are using your atlas to read it, it will be very, very easy for you to understand what the clavicle is. First of all, in the Latin word, clavicle means key. 1. Clavicle means key. 2. You can also call the clavicle the collar bone. 1. Clavicle means key. 2. Clavicle, it can also be called the collar bone. 3 is an S-shaped curve. So if you look at the clavicle or you are holding it or you see it on your screen now, you see that it's an S-shaped curve. Just look like an S shape. And it is the only horizontal bone, or we can call it the only long bone that is horizontally placed. All long bones are vertically placed, just like the humerus, the ulna, the radius, the femur, the tibia, the fibula. They are all horizontally. They are all vertically placed. But only the clavicle is the only long bone that is placed horizontally. And if it's placed horizontally, what happens? It is connecting the upper limb to the sternum. It is connecting the upper limb to the sternum. So what part of the sternum? So you go watch my video on the sternum when you are done with the upper limb. Now the sternum you have the manubrium, you have the body, you have the xiphoid. The manubrium, the body, and the xiphoid. So it's connecting to the manubrium of the sternum. So now you have a medial end attaching to the manubrium and a lateral end attaching to the acromion process of the scapula. So that is how it is connecting the upper limb to the sternum. Don't forget it now. So another important thing, that you can palpate your clavicle all to its extent, which means from its medial end you can feel it all through to the lateral end. Very, very important. Throughout its connection, because I said it's connecting the upper limb to the sternum, which is at the trunk level. Now another important thing is that this clavicle allows for the attachment of muscles. So most muscles get their origin from the clavicle, or some muscles attach to the clavicle. So some attachments comes from the clavicle. Another thing again, that if you put a blunt force to your upper limb, now you can feel it around your chest region, because there's a transmission of force from the sternum to the upper limb and from the upper limb to the sternum. You get it now? So that is one thing. It allows for the attachment of muscles, and it allows the transmission of force from the upper limb to the sternum to the thoracic region, and from the thoracic region to the upper limb. And that thing again, you have to know that due to the orientation of the clavicle holding the two plates or connecting the two structures together, it allows for the free swinging of the upper limb about any point. So you can swing your upper limb about any point because they are far away from the sternum. So the clavicle just acts as a hinge part or as a connection which allows the upper limb move freely because of its connection with the sternum. So since you have understood this part very well, so I'm picking it one step at a time so that you understand what each one means, because I want to make it as simple as possible and exam oriented, what you should know for your exams. Now, what are the peculiarities about the clavicle? Number one, I told you it is the only long bone that is placed horizontally. It is the only long bone that is placed horizontally. It has no medullary cavity. So what is made of medullary cavity? Which means it doesn't have any spongy bones where you can make red blood cell from. So it doesn't have any medullary cavity. In your histology, you will do the spongy bones and the compact bone. The compact bone is the hard part that is outside, while the spongy bones is inside. So it has no medullary cavity, and it is subcutaneous all to its extent, which means you can palpate it all to its extent. It's the first bone to ossify. Are you getting me? It's the first bone to ossify and the last bone to complete ossification, which means it is the first bone that starts forming at first, at about the 5th week of life, to 5th to 6th week of life. That's when the clavicle starts forming. And it's the last bone to ossify, which means it's the last bone to completely fuse, which is at 25 years. So I start by 5 and I finish at 25. That is very simple. 5 years, 5 weeks in the womb and 25 years outside the womb. Do you get it now? And that thing again, it is the only long bone that ossifies with two primary centers. What are the two primary centers? In the diaphysis. So if you go to your histology, there is the difference between epiphysis at the ends of the bones and diaphysis at the middle of the bones. So it has the only bone that ossifies with two primary center. Don't forget. Now another thing you have to know, that each long bone which is ossified in the membrane, you get it now, so it undergo what we call membranous ossification. So there's what we call endochondral ossification, the bones that ossifies with cartilage, and the one that ossifies in the membrane. So it is the only long bone that ossifies in the what membrane. Do you get it now? Yeah, but its medial end ossifies in the cartilage. So we have a medial end that is connecting to the manubrium and the lateral end that is connecting to the acromion. So but its medial end is ossifying the cartilage, which means its medial end undergoes what? Endochondral ossification, while the lateral end undergoes what? Membranous ossification. Don't forget. Hope you understood it. And the last one, that it pairs to cutaneously by the word subclavicular what? Nerve. Subclavicular what? Nerves. So we have given you the peculiarities about the clavicle. So very, very important. You have to know these peculiarities. Like I said, I'll make it much more easier for you. Now, under the part of the clavicle, we have two parts of the clavicle. You have the ends of the clavicle and you have the shaft of the clavicle. You have the ends of the clavicle and you have the shaft of the clavicle. Like I said, it's on your screen. I'll just make it easier for you. The ends of the clavicle, you have the medial end, which you call the sternal end, and you have the lateral end called the acromion end. Don't forget, medial end, sternal end, because I am connecting to the sternum, and lateral end acromion because I'm connecting to the acromion process of the scapula. So that's how it is connected end to end. Why the middle part is the shaft. The shaft is very curved, and under the shaft you see a dipping part, so which you are seeing on your screen. You see a groove that is dipping called the subclavian groove. So the shaft is connecting the both ends of the bone together at the middle part. You get it now? Don't forget. Again, the lateral end is connecting to the what? Acromion process of the what? Scapula, while the medial end is connecting to the what? Sternal end, which is the manubrium of the what? Sternum. So it's easier to know that there's a joint in both places. If I am medial end, I'm connecting to the manubrium of the sternum, I'll form what? A sternoclavicular joint. A sternoclavicular joint. Why the next one? If I am the lateral part, or I call it the acromion end, connecting to the acromion process of the scapula, I'll form an acromioclavicular joint. So you have an acromioclavicular joint in the lateral end and sternoclavicular joint in the medial end. So since you know that already, you should also know that in the lateral end there's what we call there are ligaments there, about 2 ligaments. Very, very simple. Like I said, I want to go straight to the point to make it more easier for you. There are 2 ligaments in the medial and the lateral end. Now the first ligament in the lateral end is the acromioclavicular ligament. Acromioclavicular ligament. Acromioclavicular ligament is covering the acromioclavicular joint. Don't forget, acromioclavicular ligament covering the acromioclavicular joint. Since we have said that one too, the next one is in the medial end. Since we have sternoclavicular joint, we also have sternoclavicular ligament. Don't forget, sternoclavicular joint, sternoclavicular ligament, acromioclavicular joint, acromioclavicular ligament. So in the lateral end also, you also have one ligament also there, and the ligament is called coracoclavicular ligament. Coracoclavicular ligament. Why do you have coracoclavicular ligament? Why? Because you have 2 depressions, which you are seeing here. You have 2 depressions here. You have the conoid part, which is the conoid depression, and you have the trapezoid line. You have the conoid depression and you have the trapezoid line. So I'm showing you on your screen. In the lateral end, if you are facing the lateral end is just flat, while the medial end is circular, is much more circular. So in the lateral end, under the surface of the lateral end, you'll be seeing a conoid process, or you see a conoid depression. It's just that part of the bone that is shooting out, which you are seeing on your screen. You have the conoid depression or the conoid pointing process, and you have the trapezoid line. Now, the trapezoid line and the conoid process forms an origination of a ligament called coracoclavicular ligament. So it is attaching to the clavicle and it's attaching down to the coracoid process. So that's why it's called coracoclavicular ligament, because it's attaching the clavicle to the coracoid process. So two ligaments, you have the acromioclavicular ligament covering the acromioclavicular joint, and you have the coracoclavicular ligament because it's attaching the clavicle and the what coracoid process. Hope you're understanding it. Very, very easy. So the next one in the medial end, I told you there, since there's the sternoclavicular joint, you also have the sternoclavicular ligament. So in the medial end, you have a depression called the costoid tubercle. So the costoid tubercle allows for the attachment of the what costoclavicular ligament. You get it now? So you have the sternoclavicular ligament and you have the costoclavicular ligament, because the costoclavicular ligament is attaching to the clavicle, the costoid tubercle of the clavicle, down to the rib. Are you getting now? So don't forget, you have a sternoclavicular ligament and you have your costoclavicular ligament attaching to the what clavicle, the medial end of the clavicle, and the what the rib. Don't forget. So we have two ligaments and the medial and lateral end. So sometimes you can also see in the medial end there's also called the interclavicular ligament. Interclavicular ligament holding the two clavicle, holding the two clavicles. So the interclavicular ligament attaching the medial end of the right clavicle to the medial end of the left clavicle. So we have talked about the joints, we have talked about the ligament. The next thing is muscles. So what are the muscles attaching to these two ends? Like I said, we are picking it one after the other. Now in the lateral end, you have two muscles attaching there. In the lateral end, you have two muscles attaching there. Now you have the one attaching in the anterior aspect and you have the one attaching in the posterior aspect of the lateral aspect. So you see it on your screen. In the lateral aspect, I told you that it is flat. The medial aspect, I told you it is quadrangular, it is circular. Now in the lateral aspect, in the anterior part of the lateral aspect, the deltoid, the anterior fibers of the deltoid muscle is originating from there. The anterior fibers of the deltoid muscle is originating from there. In the posterior lateral part, you have the trapezius muscle. The anterior fibers of the trapezius muscle is originating from there. So in the front, you have the deltoid anterior fiber. In the back, you have your trapezius, the anterior fiber. Don't forget. Now, if you go to the medial end, you also have two muscles. What are the two muscles? In the anterior aspect, you have the anterior fiber or the clavicular head of the pectoralis major. Don't forget. In the medial anterior end, now if you look at the medial end, the anterior version, you have the what clavicular head of the pectoralis what major. While going to the posterior end, not even the posterior, at the superior angle, you have the origination fiber of the sternocleidomastoid. Don't forget. So sternocleidomastoid in the superior part, while the anterior part is the clavicular head of the pectoralis what major. So two muscles, very, very important. Two muscles at the lateral end, two muscles in the medial end, two ligaments in the medial end, two ligaments in the lateral end, one joint in the medial end, one joint in the lateral end. So simple. So you revise it, you know it, don't forget it. Now the last one we'll be talking is the ossification. Like I told you earlier, the clavicle ossifies with three centers. You have two primary center and one secondary center. Two primary center and one secondary center, but there's usually two secondary center occasionally, because there's usually permanently the sternal end have the secondary center, the sternal end, which is the medial end, has the secondary center, but occasionally there's usually a secondary center in the lateral or acromion end. Don't forget. But if they ask you in your exam, there are three centers of ossification: two primary center and one secondary center. But some questions or some literature can say four centers, which is two primary center, two secondary center. But you just know that occasionally the lateral end has a secondary center. So now the two primary center is in the shaft. So where the medial and lateral end meet in the middle of the shaft. So that's why we call it two primary center, one for the medial end, one for the lateral end. Why the secondary center is usually in the medial end? And I told you that they ossify with what? Membranous ossification, except from the sternal or medial end that ossifies with endochondral ossification. Don't forget. The clavicle ossifies with membranous ossification, except from the medial end that ossifies with what? Endochondral ossification. And the primary end ossifies between 5 to 6 weeks of intrauterine life. 5 to 6 weeks, which is the first bone to be ossified. while the secondary center ossifies or fuses between 19 to 20 what years. Don't forget, 19 to 20 what years. So if they ask you membranous ossification, why the medial end is what endochondral what ossification. So now you have to understand on the clinical part of the clavicle. Now what used to happen, there's usually a fracture of the clavicle. So the fracture of the clavicle is usually at the shaft, at the middle third of the shaft, which means the meeting point of the medial and lateral end. So when there is a blow or a trauma to that area causing the fracture of the clavicle, what happens? Remember, the clavicle borders the cervical-axillary canal. The clavicle borders the cervical-axillary canal. So if you fracture the clavicle, what happens? You damage structures that passes into the cervical-axillary canal. What is the cervical-axillary canal? At the back of your clavicle, that holes that is showing at the back of the clavicle is called the cervical-axillary canal. So if you fracture your middle one third of your clavicle, what happens? Watch it. If you break it in, what happens? Your medial end will what go up, while your lateral end will what depress. So let us see, if you break it now at the middle one third, what happen? That fracture will cause an elevation of one part of your clavicle and the depression of one part of your clavicle. So the medial segment which will what elevate, so the medial segment will go up while the lateral segment will depress, causing the joints to go down a little. So if you fracture the middle, one end will go up, which is the medial end, one end will what go down, which will cause some of the muscles that are originating from there they will be weak immediately. You get it now? They will be weak immediately. So now that middle end is the weakest point where fracture can occur. Fracture cannot occur in the medial end because of the sternum is very strong. Fracture cannot occur in the lateral end because it contains bones and the shoulder joint is also there. So the weakest point is in the middle. You get it now? So don't forget. The next one is under the ossification. Now you also have what clavicular dystosis, and you have the cleidocranial what dystosis, which is just a congenital abnormality of the what clavicle. The congenital abnormality of the clavicle. So you have clavicular dystosis and cleidocranial what dystosis. Are you getting me? What is clavicular dystosis? Is when the medial and lateral end do not meet in the middle. So if they do not have a shaft and they do not meet, you call it what? Clavicular dystosis. You get it now? So when a child is now born without a clavicle, you call it the cleidocranial what dystosis. So you have clavicular dystosis and you have cleidocranial what dystosis. Finish. So we have come to the end of the clavicle. Hope you understood it. Where I introduced the clavicle, I talked about the peculiarities of the clavicle. So just look at the bone, use the bone to interpret what I'm saying. It is so simple. Don't need to stress. It's just so simple. Follow it, hold the bones, look at your atlas, and look at the usefulness of everything. We have one joint at each side, we have two ligaments at each side, we also have two muscles at each side, and there's only one muscle in the middle called the subclavian or the subclavius what muscle, attaching to the what subclavian what groove. So simple. So I hope it all made sense to you and you have understood everything I've talked about the clavicle today. So if you are new to my channel, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you're sure to be all notified. So if you want me to make a video for you, just put it down in the comment section. When I make that video, you will see it, and you also share it to all medical students. Very important also. So I'll be seeing you in my next video, which is a scapula. Stay tuned, always watch my video every time. Bye bye.